Horses are very special to me, and I wanted to share what I've experienced, what I have learned about the healing power of horses. So, every horseman knows that the relationship with a horse is special, but for those who are recovering from injury or who live with mental or physical disabilities, this relationship can open new realms of possibilities. Horse and human become partners in a therapeutic relationship which offers the opportunity to explore abilities rather than disabilities. Patients learn to be at ease, not diseased. Recent studies have shown that equine therapy can make a dramatic difference in the lives of people with dementia, which currently affects over 5 million Americans. With a rapidly aging population, these numbers are expected to rise. In fact, the Institute for Dementia Research and Prevention reports that someone is diagnosed with the condition every 67 seconds. The study, The Science Behind Horse Therapy for Dementia Patients, was published in the latest reissue of AnthroZoos, a multidisciplinary journal of the interactions between people and animals, and performed in collaboration with Ohio State University, an equine therapy center, and a Columbus daycare center. In the month-long study, 16 volunteers with dementia were divided into 2 equal groups, one which stayed at the Center for Arts, Crafts, and Exercise, while the other group traveled by bus to the Equine Center. Caretakers, faculty, and students from the daycare center from the Ohio State College of Veterinary Medicine were on hand to supervise and assist. The horses in the study had been selected for their exceptional gentleness and calmness and were all regular mounts in a therapeutic riding program for children with disabilities. Under close and careful supervision, people with Alzheimer's and dementia were able to feed, groom, and walk horses, leading to an elevated mood that reportedly lasted all day. Patients who had visited and cared for the horses were also less likely to become agitated or resist care hours after the visit. Participants, even those who were normally very withdrawn, became fully engaged in the experience, talking and laughing. Even more telling, clients became more physically active, some asking for help to leave their wheelchairs, then walking unassisted. Researchers noted that improvements became more pronounced. With each visit to the equine center. When the clients returned to the daycare center, their behavior was tracked with the modified nursing home behavior problem scale, which rates frequency of resistance to care, restlessness, and agitation with angry outbursts. Relatives noted the improvement as well, commenting that their loved ones remembered their positive experiences at the equine center and were eager to communicate their experience. I'd like to share an experience that I also had in working with dementia patients and horses. I have a barn and an acreage across the street from a nursing home, which is, what's it called? I can't remember the name of the facility, but I had one of my boarders was a senior in high school, and she had a community project that she needed to do. And so she and I buddied up and decided that we would go to the nursing home and offer to have the facility bring patients over to our barn, and we would they could have contact with the horses once a week for 8 weeks. And what we found was, and nothing was written or anything, was that the patients became more social. They started interacting not only with staff, their appetite increased, they were less agitated, and their families even noticed a difference and would come over with the patients on the weekend and talk about what a wonderful experience it was for their patients, for their family members. Another treatment strategy utilizing horses is hippotherapy. Hippotherapy is a physical, occupational, and speech-language therapy treatment strategy that utilizes equine movement as a part of an integral intervention program to achieve functional outcomes. Equine movement provides multidimensional movement, which is variable, rhythmic, and repetitive. The horse provides a dynamic base of support, making it an excellent tool for increasing trunk strength and control, balance, building overall postural strength and endurance, addressing weight-bearing and motor planning. Equine movement offers well-modulated sensory input to vestibular, proprioceptive, tactile, and visual channels. During gait transition, the patient must perform subtle adjustments in the trunk and maintain a stable position. When a person is sitting forward astride the horse's walking gait imparts movement responses normal to human gait. The effects of equine movement on postural control, sensory systems, and motor planning can be used to facilitate coordination and timing, grading of responses, respiratory control, sensory integration skills, and attentional skills. Equine movement can be used to facilitate neurophysiological systems that support all of our daily functioning needs. Hippotherapy uses activities on the horse that are meaningful to the client. Specific riding skills are not taught, but rather a foundation is established for neurological function and sensory processing. Physically, hippotherapy can improve balance, posture, mobility, and function. Hippotherapy may also improve psychological, cognitive, behavioral, and speech-language functions for all clients of all ages. Equine-assisted psychotherapy is an experiential modality of mental health treatment. This is what I do, and I will explain what I do. Equine-assisted psychotherapy is an experiential modality of mental health treatment. EAP specifically addresses mental, emotional, and behavioral issues of individuals, groups, and families. The focus is on human skills, not horse skills. In EAP, the clients become themselves. Sessions are held in an arena where the horses are untethered. The exercises between the human and the horses are structured and facilitated to deliberately address the reasons clients came to therapy. The sessions are designed to best create metaphors to real life. This allows for metaphorical learning, as everything done with the horse is related to what is happening in relationships at home, school, or at work. The horses mirror the human emotion. And if you'd like, I'd like to show you this ride-along demonstration on hippotherapy. Jasmine, I may need you to help me here.
Today we're going to show you the Shea Center's concept of a ride-along. We've used tape to illustrate the movement points of the horse's pelvis and of the rider's spine and pelvis. This will give you a visual representation of what happens when the horse's pelvis is walking. So now we're going to watch the rider and the horse walk away from us. As the horse and rider are walking, notice first the rider's pelvis as it moves three-dimensionally, forward and back, a little rotation, and a little side to side. Also compare that with the horse's pelvis. It's also moving front and back, side to side, and a little rotation. Next, we're going to mount the rider so you can compare the movement as the rider sits astride the horse. Now we have the rider mounted astride the horse. Let your eyes look at the movement. Notice how her pelvis swings side to side, a little front and back, and has rotation. Now compare the same movement to the horse's pelvis. There's no piece of therapy equipment that can mimic the same three-dimensional movement. This three-dimensional movement is the same movement shown when the rider is walking on the ground. So essentially, as the rider sits on the horse, she's getting the same three-dimensional movement as a person walking on the ground. Now we're going to show you some different movements that we do in a hippotherapy session and how we utilize the movement to strengthen the rider's muscles and balance reactions. First of all, we're going to halt the horse. As we stop the horse, her back muscles have to kick in, and now we're going to walk on, and her stomach muscles kick in. The simple nature of a transition helps her to stabilize her core. Let's try that again. As we halt the horse, her back muscles kick in, and we're going to walk on. As we walk on, her stomach muscles have to kick in. So that she doesn't lose her balance up there, her body automatically performs riding reactions and keeps her in her center of balance. Next, we're going to perform a circle. So the horse is going to walk in a circle. We're going to look at it from behind. As we're looking at the rider from behind as she circles, the left side of her trunk muscles shorten and the right side of her trunk muscles lengthen. So as a therapist, we can use this information. If I have to work on someone's trunk muscles and stretch the right side, I might send them into a left circle. And if we can change direction, we're going to do a circle to the right, like a figure eight. So turn left, and then we're going to turn right. So we're going to turn to the right, circle to the right. As the trunk muscles on the right shorten, conversely, the trunk muscles on the left lengthen. So again, as a therapist, we'll use this information to make a difference in our riders. And now we're going to halt, and we're going to turn the rider sideways. So why don't you face the outside of the arena, Trish? And then we'll move the camera to the inside so that we can see the weight shift. As the rider's sitting sideways, this is a position that we usually use for children, not necessarily adults, but this will give you a visual representation of what's happening at her pelvis. And we're going to walk on, the horse is going to continue walking. As we walk sideways, her pelvis gets a lot more lateral weight shift, right and left, and her upper trunk has to stabilize in a forward and backwards motion. They're going to circle right around us. As they circle around us, gravity is going to take her to the outside of the circle. So her back muscles have to kick in to stabilize her so she doesn't fall off the horse. So finish the circle. Conversely, if we did a circle the other way, you can imagine her stomach muscles would have to kick in. And then we're going to halt here, and we're going to turn Trish backwards. As Trish is turning backwards, just imagine the amount of motor control and motor planning that she has to do to turn into that position. Notice the alignment of the tape on her thigh. Just the fact of sitting backwards has put her pelvis in more of an anterior tilt. So her pelvis is more upright than it was when she was sitting forward. As she's backwards, I've also given her a wider base of support back there with the horse. Trish, can you just point to the horse's pelvis back there and how wide it is? As she presses down on the horse, she can get some weight bearing through her wrists, her elbows, and her shoulders, which will all increase her proprioceptive information of her joints. So first of all, we're going to have you sit up, Trish, as we walk. And sitting backwards, we're going to demonstrate a couple things as we go. So let's have the horse walk on. As we walk, and she's sitting backwards, obviously she's moving through space backwards, so her back muscles are going to have to kick in. She's also getting a lot of sensory input that's different for her vestibular system. She can't see where she's going visually, so she has to figure out where her body is in space and able to balance herself in a backwards direction. Go ahead, Trish, and put your hands on the croup of the horse. As she weight bears down through her wrists, again, we can increase the proprioceptive input through her wrist, her elbows, her shoulders. We can increase the co-contraction of her shoulder blades and her neck muscles and strengthen her head and neck control. As she goes onto her elbows, a little bit lower position, the horse really swings her body. She gets a lot more vestibular input. This is a position we might use if somebody is a sensory seeker and needs a lot of sensory input. Obviously, the closer she gets to the horse, the more she's going to swing. And you can go ahead and sit up, Trish. Also, as a therapist, we might use this position if somebody is really low tone. This position actually can stabilize them because they have a wider base of support to balance on backwards. We might even incorporate games up here. We might play with a ball. We might play puzzles or any sort of activity that we can encourage on top of the horse to make it fun, but at the same time getting the therapeutic value of the trunk control, the balance reactions, and the strengthening. And we're going to go ahead and halt here. And let's turn all the way around to the front so we can take a last view at how the horse's pelvis mimics that of the human person walking. Okay, let's walk on. So just lastly, in review, just visualize and look at how the horse's pelvis mirrors exactly that of the rider. So when the rider sits astride the horse, they're getting the same three-dimensional input that they are when they're walking on the ground. Imagine if a child has a disability and they never walked. This input will allow them to use their core trunk muscles and balance reactions to practice walking over and over, repetitiously in a 30-minute session. It also allows them to get stronger in their trunk control, just by the simple nature of doing simple transitions. And the biggest thing that is very beneficial is the psychological impact. Imagine if you're a child in a wheelchair and you're always looking up at people. Now you're sitting astride the horse and you actually get to look down at people. It's very empowering. So not only is it fun, it's therapeutic, and many of the kids feel like they're just out here to have a good time while we're really working them and making a difference in their functional outcomes. Thank you.
I've talked to several of the physical therapists here, and they definitely think that this would benefit many of the clients that we work with here, like people with MS, because their balance is, they tend to lose their balance and they have difficulty walking at time as their disease progresses, and it could very well benefit a lot of the populations that we treat here. Anybody have any questions? Robert?
Don't get nervous. Let me ask you a question. My granddaughter had speech therapy
Right.
on Taco Horse, and that was covered by insurance. Are most of these other therapies, the physical therapy, the balance issues, everything else, are those also something that's generally covered by your insurance?
Well, I know most equine therapy facilities will take Medicare, Medicaid. And so I don't know, I know Medicare and Medicaid will pay for certain services like that, as long as there is, obviously, the doctor recommends it. I don't know about the other insurance, private insurances. I don't know if private insurances will pay.
But if you had an insurance plan,
Yes.
that did cover it, they could be recommended. My second year follow-up was that is, how many doctors are actually aware of this and the use of this, and or all the references, all the referrals coming from a handful of physicians?
I can't tell you that. I know that the major populations that are using these services right now are people who have mental retardation, or I know that autistic children also, get these services, and those are the ones that are primarily, referred. I don't know of any of. I had talked to one of the hippotherapists that I know. She hasn't had any adult referrals, and I think it's just a matter of making the referral and seeing if obviously if they're on Medicare very well may pay. So I think it just needs to be tested. Yeah. But I know that she doesn't have any adult clients at this point in time. Yes.
You said you did a study at this group home across from an acreage.
I did. Well, I didn't do a study.
For 8 weeks?
Yeah. What it's the Marquee. It's a Marquee facility, and it's not only they do, they care for it's a long-term care facility for people with dementia and Alzheimer's, but they also do, after people have been in the hospital, and they do, rehab. So the young woman, she needed to do a project for her high school as a senior, and so she went over and talked to the facility and asked if they would participate in doing an equine therapy project. And what we did, they had 8 people. The caregivers would bring the patients over, eight caregivers, and they came over for 8 weeks. And this young woman and I would take our horses out. I have many horses, I have many donkeys, and then we have, large horses. And we would take them out, and they would pet them, and we would talk. And it was a very social thing, but also they were able to pet the horses and love the horses. My minis are very friendly, and they would put their heads in the people's laps, and they would love on them. And it was interesting to hear the stories that would come out of the mouths of these seniors. And the care providers were amazed at what they learned about these people that they had never even known before. I mean, that they hadn't known, even though they were there, they didn't know the stories, and they hadn't engaged, the patients hadn't engaged as much as they did when they came over. When the families would bring their loved ones over, they would talk about how their loved ones were talking about memories that they hadn't shared with them before, and how wonderful it was because they were much more engaged when they would come to visit. And so, I mean, obviously it wasn't recorded or reported or anything, but it was a wonderful experience for them and for myself.
Was there after the 8 weeks when this ended, were the people depressed, or was there an attempt to continue this effort? Well,
I would go over. They would ask me to come over during the holidays, like when they would have a party or something, and I would take my minis over there during the parties and that. But we continue to have people come over, and they'll come over. We have a big gate, so you can see the horses, and you can see the horses roaming around and playing with each other, and they'll just stand, sit there in their wheelchair or stand for hours and watch. And if I see them out there, I will go out and take a horse out or whatever. But yeah.
Is your acreage across the street?
Yes, it is.
Oh, I see. Okay, so
Yeah.
it makes it convenient.
Yeah.
Do these people have to sign a waiver?
Yes.
Okay.
Yes. There's a release form that in Nevada, there's a disclaimer. It's a sign that you put on your fence. It's a disclaimer that anything that is, when you're involved in horses, there's always a risk. But yes, we do have, for our own good, for our own purposes, we have a release form that we have everybody sign. Because you never know.
Who took on the responsibility at this facility? So,
It was the.
I mean, if the people have dementia, they can very well, I'm just curious.
They were all in wheelchairs, and they had volunteers that would wheelchair or push the wheelchairs out. Yeah.
Thank you.
Yeah. So the activities director was the one that kind of got it all organized from that end, and we felt pretty
That
comfortable.
sounds good.
Yeah.
Thank you.
Yeah. Any other questions?
Okay.
Any from the remote sites? Any questions?